to equity and inclusion principles. I believe firmly in making space at this table for all people. All of that has helped, build the trust that we're really collaborating to reach the most people, act within community instead of upon community.
The Building Community Resilience Approach, or BCR, aims to address adverse childhood experiences, including exposure to abuse or parental addiction, with the understanding that they often occur in the context of adverse community environments.
What we're trying to achieve here, I think, is challenging. There are really three elements at play. There's the medical system, the public health system, and the community. And both the medical system and public health system are trying to engage with the community around a common problem.
As the pair of aces tree depicts, communities planted in a soil steeped in adversity bear the fruit of adversity, such as substance abuse, household dysfunction, and childhood neglect. Foundational to the BCR approach is the evidence-based understanding that supportive buffers build resilience, giving individuals, families, and communities the ability to not only bounce back, but also bounce forward. BCR began in 5 cities with child health systems and has grown to include cross-sector partners that include schools, judges and court officials, social service partners, city officials, and local health departments.
If we think about public health and health care coming together to make an area or a region safer, healthier, and more resilient, there's a lot of connection points there to get on board with that common vision.
In 2017, BCR partnered with the National Association of City and County Health Officials, or NACHO, to forge partnerships with local health departments. By doing so, we hope to enable multiple sectors to work collectively toward long-term solutions. BCR teams are working to partner across systems, including education, courts, and law enforcement, with the understanding that to improve child, family, and community outcomes, we cannot address these challenges alone. A key lesson learned so far: building community resilience requires trust and relationship building that takes time.
Why don't people do it? It's because it's hard. And it's because it's not something that you're going to have this nice report at the end of the year to say, look what we've done.
I think powerful, deep change takes time and it takes trust. And it took probably 1.5 years for the community to trust me and for me to build those relationships.
Supporting parents is a key step in building family resilience and community trust. A partnership between Cincinnati Children's Hospital and Beach Acres Parenting aims to do just that. In this partnership, the two are co-located with parent specialists inputting data directly into patient electronic medical records as part of the pediatric primary care team. This co-location enables immediate referrals to supports and services that address health as well as social needs.
I think the full integration really supports the families holistically.
What we're going for here is that full integration. We're trying to make it so the parenting specialist just seems like another member of the practice.
There has to be something different, but
Partnering across sectors and systems is a messy, albeit necessary process to best serve children and families.
Understanding who the other partners are that we might need around the table, using the language that helps them understand this work and how important it is, buy-in. That's been a challenge.
Sometimes, the greatest challenges can be within our own organizations.
I think the second challenge is just getting the organization to understand the importance of our work.
The nation's opioid crisis has created an urgent need for health care and local health departments to coordinate efforts in response to complex emotional and physical traumas endured by families and entire communities. This is especially urgent for the Cincinnati Building Community Resilience Partners, where Ohio and Kentucky lead the nation in opioid-related deaths. Some officials have described the carnage as a mass casualty event.
There were 2 children who had called the police because both their parents, they found them dead in the house. We had a situation up in Montgomery County where 3 children found their parents dead at home and had to call the police. So the trauma that we are seeing for children, it is burdensome to even think about it as an adult.
4 of this weekend's overdoses and
The nation's opioid epidemic has revealed gaps in foster care and kinship care, and a new opportunity for the BCR approach to serve children and the grandparents trying to care for them.
They may have great supports in senior services system, but suddenly they're expected to know everything about the early childhood education system or the pediatric healthcare system, and they have no idea what to do. So we try to offer supports to them to help them connect to needed services for their children.
The BCR process provides organizations the opportunity to rethink their role in community.
As we think about health equity and we think about the kinds of challenges faced by some communities, there's a real need for an anchor institution. And by an anchor institution, I mean an institution that can provide jobs, job training, local investment, local purchasing.
Anchor institutions could be hospitals, universities, even utility companies or municipal offices. BCR's Portland team has an anchor institution in Concordia University, providing financial support for construction of the new Fabian School, as well as staff and program supports. Most recently, the city of Dallas joined the BCR effort as part of Rockefeller Foundation's 100 Resilient Cities initiative and became the backbone of BCR's work in Dallas. With City Hall on board, we hope we have the opportunity to reach across city agencies to build a resilient Dallas. Our role at BCR is to facilitate partnerships that will create more vibrant communities for children and their families. So how do we work together for the benefit of children, their families, and communities? It's not about creating new processes as much as aligning resources already in place. By doing so, our BCR partners are discovering they can have substantial impact on the lives of children and the well-being of communities. This is building community resilience at work.